Hello, everybody. Welcome back to Project Move with me, Dr. Josh Weidman, and myself, Matt Tremarkey. And today we're going to continue down the kind of biohacking topics. And up next is using hot and cold therapies to help with our everyday performance. And I kind of, both of these kind of deal with this idea of hormesis. Josh, you want to kind of explain what hormesis is?
Yeah, basically it's using a bit of stress and then the goal is to get a positive adaptation afterwards. So, if you think of exercise, we create a stress to the muscle with the intent of it either getting stronger, bigger, whatever our goal is, but it's the stress that then creates the shock to the system, which then the ultimate goal is a positive adaptation. So we're using these temperature changes to kind of simulate that same effect.
Yeah, what's kind of interesting is like this is something that's kind of getting a lot more popularity, and it's kind of this new trendy thing to be kind of doing, but it's actually been around for a very long time. So we're going to kind of take
Yep.
a deeper dive in each as far as using traditional Finnish saunas, using near infrared, warm bath, and then kind of looking at the different cold water immersions
Hmm.
and how they work.
Sure. Yeah, I think that there's a lot to uncover here.
Yeah, so let's kind of maybe start. We'll start with some heat therapy. So there's a lot of studies that has been done by the Finnish for a very long time as far as uh, how heat can help in, I guess, many different areas. I think uh, there's some crazy statistics out there as far as the benefits of using sauna use, as far as increasing lifespan, decreasing Alzheimer's, and decreasing uh, cardiac disease.
Yeah, there's a lot of positive adaptations that can come from heat exposure. Interestingly enough, it's almost like low level like endurance exercise. It's a similar thing. So in the elderly, as long as we create a nice safety net, if they can't tolerate certain exercise, we technically could be using, some sort of heat exposure to promote some of these, vascular benefits.
Yeah, so I think kind of the idea of using this heat for therapeutic use is it mimics like cardiovascular exercise.
Right. So we get this dilation of the blood vessel, and ultimately we're using nitric oxide and endothelial function. I know that's a big word, but like that's basically the lining of the blood vessel. And in a healthy blood vessel, that's nice and smooth, and it allows for the blood to just kind of naturally flow through unrestricted. But we know whenever the walls become damaged or there's maybe some rough patches, that's where the plaque builds up. And so if we can maintain, smooth passage, we're allowing for, better, heart health, if you will.
Yeah, and kind of on that heart though. So I think the idea is that if we have too much stiffness in our arterial system and our venous system, the stiffness is basically causing our heart to have to work more. Like allowing more elasticity allows the kind of blood flow to kind of pass through and not really accumulate all these kind of different like plaques and things of that sort. So the more elasticity we can have in there, the better our heart health is going to be.
Yeah, that would be the case because, you know, we need a certain amount of pressure to be healthy, but we don't want it too high. We don't want it too low. There's a nice sweet spot right in the middle. And so by having that elasticity, it allows for, better flow, but it also allows for, a little less work, if you will, for the heart. So again, we kind of have to find that sweet spot because if the vessels are so stiff, that's going to create more resistance to the flow, which is going to make the heart work harder. But we don't want them so wide open that there's no resistance either. So finding that optimal resistance is really what we're after.
Yeah, and we kind of see this people who have this extra stiffness in their pulmonary system is kind of what we call hypertension, high blood pressure.
Correct, correct. So, I think the Finnish study, it's a 40% reduction in all-cause mortality, which is a pretty significant decrease, right?
Yeah.
So, that's basically the same as a smoker that stops smoking. They're going to get the same type of benefits, right? So it's really a significant health benefit.
Yeah, and then as far as cardiovascular health, I think it's like even something like 60 plus percent decrease in cardiac diseases. So I mean, it's just mind blowing as far as like how much improvement uh, that can actually have on you.
All by just sitting in a hot box, right?
Yeah,
It's just something that you wouldn't think, because a lot of times I think people feel like, oh, well, I've got to be doing something, right? So this seems like idle time, so it might seem like, oh well, it's not that beneficial, but it clearly is providing some benefits beyond what we can feel or even see.
yeah, we were kind of talking about this the other day. So the Finnish have been doing studies on this for a long time. I mean, they're higher in longitude.
Yeah, and I think to not to change too quickly, but the studies were longitudinal studies. So we were looking at like the same individuals for like 20 plus years. So it's not just a 6 week study and we saw these acute benefits. We're actually following these people for long periods of time. So we're getting real data that it can't really be disputed.
Yeah, and I know they controlled across several different factors, so they didn't take just like a healthy bias study. So the people who, you know, people who are healthier and more active, are going to do more of these types of
Sure.
healthy things like, use sauna. But this is actually accounted for that, and they took, people who were smokers, people who were obese, and everything in between, uh, and they showed like these significant improvements in their health.
Yeah, so it goes to show how powerful it is if you're someone who has maybe some of these chronic diseases or predispositions, that you're still getting benefits. I'm not saying to, be a smoker, but at the same time, you're getting these positive benefits by utilizing the sauna.
Yeah, so the Finnish really kind of pioneered this, and like I said, they've been studying it for a long time.
Hmm.
So typical Finnish sauna is like a dry sauna. So it's a very dry heat, not much humidity, but they're using a much higher temperature. So somewhere between, I want to say it's like 150 to kind of like 210 degrees Fahrenheit.
Yeah, I
Maybe
think
160. I think it's like 165
the
is the minimum.
the study was a pretty wide temperature range. If you look at some of I'm not going to say newer data, but some of the maybe more recent, I think it needs to be at least 100 and like 65, 175 degrees. That's kind of like the target number. Some of these, they got even upwards of like 230 degrees. So like that's ridiculously hot. So it doesn't have to be that extreme, but I think that if we're looking at Fahrenheit temperature, that 165, 170 is really kind of the benchmark of what we're looking for.
Uh, yeah, and then kind of I think as far as the use of these, where we kind of see these really significant improvements in health is we kind of found that it's really more once you get to that 4 to 7 treatments per week.
Yeah, there's definitely a consistency factor. So, if we think of exercise, one gym session isn't really going to change much. You can do one gym session, feel great, take a picture, and like, oh, I look the same. It's the consistency over time. And so we have found sauna is the same thing. We need minimum of about 4 sessions per week to really see these significant drops in all-cause mortality or significant drops in cardiovascular events. So it's not just the fact that, oh, I got to make time for one. You really, and the other thing too is the duration of the session needs to be, I think, what was the study? 19 minutes was the minimum.
Yeah.
So basically 20 minutes. If we're trying to just kind of create a nice even, shoot for 20 minutes at around that 175 degrees is kind of like the sweet spot to get the benefits.
Yeah, and then they're also doing other studies now, also with not just using dry saunas, but I think a little bit easier is going to be like these near infrared saunas. So it's not producing as much high of heat, but it's
Right.
a different mechanism of heating. It kind of, and we actually kind of think we talked about this in that red light
Sure.
episode. It's a little bit more penetrating heat. It uses radiant heat,
Hmm.
and so since it's not as hot, it's able to essentially penetrate a little bit deeper to create almost a very similar effect.
Right. So typical like infrared saunas, they use the far infrared part of the spectrum. So like whenever we're talking about red light therapy, um, it's typically more in the near infrared. So it's just a different part of the spectrum. But the interesting thing about both red light and sauna, so sauna is giving us heat, but it's also giving us infrared, even though it's like from rocks. You know what I'm saying? So like if we took a thermal imaging, we're going to see infrared coming off of the rocks. But the interesting thing is they really shouldn't be combined. Like I know people are doing it, but there is a bit of a contradiction with the red light and the heat because as the tissues heat, the blood comes more to the surface. So while the infrared light penetrates deep to the tissues, by blood coming more to the surface, we get the scattering effect. And so we can maybe blunt some of the red light effects with the heat. So if you're really going to do red light and sauna, they technically, I would say, should be separate. You're still going to get some benefits. I'm not saying that you're not.
No, but I mean it makes sense. Like if you're trying to use red light therapy, using it in a sauna is just you're just it's kind of a little bit of a waste.
Correct. So is it better than nothing? I would say you're still going to get some of these benefits, and so it's a bit challenging whenever you think because like what metric are we targeting, right? So it's like if we're trying to target heat shock proteins and cardiovascular, we're not necessarily trying to target collagen synthesis of our hip capsule. So it's like, what are we measuring? And so if we're doing sauna, typically it's more for these systemic effects. Um, and if we're doing red light therapy, we're trying to be more targeted. So I think that we can kind of get into the weeds as far as like, oh, well, this is going to blunt this effect. Well, we might not be worried about that effect, and we might be worried about more of this systemic effect. And you're still going to get that systemic effect from an infrared sauna.
Yeah, so we kind of mentioned heat shock proteins. So this is kind of like the big buzzwords as far as kind of these benefits that we're getting uh, from this like these sauna uses. Yeah, so kind of maybe talking a little bit maybe more about like the mechanism of action. So when we're in these saunas and in these infrared saunas, we're essentially heating ourselves up. So our body is going to, in order to deal with this stress, what it does is it causes like vasodilation. So it causes the blood vessels to just kind of open up. So
Right.
with that opening of the blood vessels, now the heart is going to have to work much harder. So we kind of get this cardiovascular like stress. Like if we were to do some sort of cardiovascular
Well,
exercise.
so let's take a step back. So why do the blood vessels dilate? They're actually trying to cool the body, right?
Yes.
But then whenever the blood vessel opens up, there's less resistance. So the heart has to create more of a pump, if you will,
Yes.
to get the blood, say, to your toes. Whereas in a smaller vessel, it took less pumping because of how that works as far as like dynamics of tubes, if you will. And so now we're creating a stronger pumping mechanism, which feeds into what you're going to probably get to.
Yeah. So in order to cool ourselves off, our blood vessels open up so we
Yep.
can essentially get more blood to the surface area of our skin. And then we use kind of evaporative cooling. Our body will start sweating, and that allows us to dissipate that heat.
Correct. Yep. Yep. So that's one of the, so that vasodilation, um, we can actually see increases of cardiac output, 50, 60, upwards of 70%, depending on the heat. So it's a pretty extreme, like that's the same thing that you would get as if you were doing a super, hard bike ride or a long zone 2,
Yeah,
session.
so it can actually be used as sometimes as a, depending on the person, a kind of like a lower barrier entry, maybe even a good starting point for somebody who's been sedentary for a little bit longer,
Yep.
who kind of wants to start somewhere, but is like, maybe doesn't quite have the joint health to support some like more heavier traditional cardiovascular exercises.
Right. So, we know that, for a zone 2 session, we really need that 45 minutes. So, if you did, say, 20 minutes on the bike and then you did another, say, 20, 25, 20 minutes in the sauna, you pretty much could get a similar effect. So we can kind of compound these things a bit.
Yeah. So yeah, kind of it's going to kind of now move back to those kind of heat shock proteins and kind of uh, the benefits of those the benefits that are created from those. So creating this sense of hormesis, our body has to kind of compensate and kind of deal with the stress that we're putting it through. And one of the things that ends up happening is kind of our body releases these heat shock proteins.
Hmm. So, the heat shock proteins can almost be a bit of like a cleanup, if you will, that we can start to see how, just due to normal everyday stresses, proteins can become misfolded, if you will. And I know that sounds a bit weird or crazy, but so these heat shock proteins actually help to either refold. So there's a whole geometry of like how our cells are shaped. And so the the shape of the cell matters. And so by using these heat shock proteins to help reshape the cell, we actually can then we either can clean up the cells that need to be kind of targeted for cleanup, but we can also then almost improve the output of the cells that might have been misfolded but have now become quote unquote refolded to function at their proper level, if you will.
Yeah, so it can either kind of like just fix damaged structures, or it can actually kind of mark them for like apoptosis for kind of just to kind of destruction, and then basically kind of then reuse those um, building blocks for something else down the road.
Which is similar to like autophagy, right? And that's kind of what we think of as like the cleanup. This is like another version of that cleanup.
Yeah, and also kind of we see this also with there's a lot of cognitive benefits that kind of come along with this as well. So let's maybe kind of talk a little bit about the uh, yeah, I guess like the benefits. I think that's something like for people who follow these uh, sauna protocols can see, if I'm not mistaken, it's like
Upwards of like 50%, 55% from just general use. But yeah, there's definitely other studies that show upwards of 60 something percent.
in like a decrease of like dementia, Alzheimer's,
Correct.
and it kind of goes along with these heat shock proteins as far as like these as far as their ability to kind of clean and fix things is it's kind of helping with I guess that cleanup crew as far as like these beta plaque amyloids that are kind of tied to like Alzheimer's.
Yeah, so that's but think of it as, again, it's a way for the body to kind of control, like, so the exhaust of normal metabolism, right? So it goes in and kind of helps to like clean things up. So if we went out to the gym and the previous class left all their kettlebells and their weights everywhere, and then the next class kind of did the same thing, eventually the gym's going to be really messy. And so think of these factors as like going in and putting the weights back on the rack. Like it just kind of tidies things up. And so if the nerves can have like a clear path to send their signal, if the vasculature can have a clear path for the blood to flow, we're going to have generally better function, right?
Yeah, and it kind of makes sense because we're improving cardiovascular health. We're essentially allowing our body to improve its ability to circulate the blood, which is needed for, I mean, not only cleanup but also for performance as well. So, like, it's also going to help from a performance standpoint as far as as we talked about in kind of previous episodes, as far as what ends up happening when, from a like a performance standpoint, when we work out or like traditional strength training.
Mm-hmm.
We go through exercises, whatever the goal is. We create actually localized inflammation in the tissue. And if we send the right signal to the nerve system then relays it to the endocrine system. And then now it, through our cardiovascular system, it pumps in the good stuff and kind of eliminates the waste products. And it actually will just like improve and speed up the process as far as seeing our traditional like gains, as you call it.
Correct. So we need obviously a good functioning cardiovascular system, obviously a good, mental and cognitive function. So anything that improves heart health is naturally going to improve brain health because, the brain gets 20% of cardiac output. And so anytime we can improve the heart's ability to pump blood or to clear waste, that's only going to help brain function.
Yes. Let's see.
So I know we've already talked about this, but we can kind of get back into that, all-cause mortality again. So I think that's a pretty significant study that really, we're talking a 40% reduction in all-cause mortality just by doing four sessions per week. Obviously, you could do this every day, but the minimum effective dose is 20 minutes, 4 sessions per week.
Yeah. So after we've kind of gone through these sauna sessions, we kind of see these almost immediate effects. We kind of see decreases in cortisol levels. We see decreases in actually some increases in then more of these happy chemicals like the BDNF, which we talked about before. So these brain-derived neurotropic factors,
Mm-hmm.
which is kind of like another way of, I think it's probably another factor that's kind of going into these preventing like Alzheimer's, dementia, is we get, as form of cognitive benefit, we get these brain-derived neurotropic factors. What we see end up happening with them is they increase like neuroplasticity and basically just the rejuvenation of like neurons, so that like we're essentially just, for lack of better words, just kind of like that cognitive brain repair process that just typically doesn't happen unless we involve some sort of physical and mental stress, which we kind of naturally just declines with age.
Yeah, it's one of those things that you just assume that, like, but the body loses efficiency as we age.
Yes.
And so really what we're talking about here is we're trying to maintain a level of efficiency that we know we're going to lose. So if we can keep as much efficiency, we're going to see less of these declines. And so, the brain derived neurotropic factor, that's basically, again, going and finding neurons that might need cleanup, and it's creating this repair process. And so, again, anytime that we can improve synaptic connections, that we're going to be able to have better, you know, cognitive function, if you will.
Yeah, and then also there's also that like stress factor that kind of goes into it. So it helps with just our abilities to be able to deal and tolerate stress.
Yeah, yeah. I think that there's something to be said that society has become a bit soft, and having a little like controlled stress allows us to handle outside stress a little bit easier.
Yeah, like putting ourselves through voluntary adversity. I mean, we see it when we work out. If we work out, we, especially in more intense workouts, it helps us learn to be able to kind of control our heart rate. So then when we're in outside, stressful environments,
Mhm.
uh, it's not going to have as quite a big of an effect on us.
Yeah, no, I think that there's definitely some improvements that we can have to knowing that this is a 20-minute session and I'm only going to struggle for 20 minutes. Like, you can kind of tolerate that, so then you can transfer that whenever you get into a stressful situation, whether it be at work or in the car or in traffic, whatever. You're going to be able to handle those stressful situations at a little bit more calmer kind of baseline.
Yeah, I think it all goes back to this hormesis, and I think with sauna, it 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 taxes and stresses so many different systems. It's just kind of why we see such a broad spectrum improvement as
Sure.
far as like improvements, and like we saw that 40% decrease in all cause mortality.
Right. And then what is it, like a 61% reduction in cardiovascular related deaths? So, I mean, that's again a huge decrease. So, you know, this is basically, I'm not going to say low cost, but it's not something that is like where it's not that big of of a deal as far as like, oh, I've got to dedicate 2 hours to go do this long bike ride. Like, it's 20 minutes. So 20 minutes, I think most people could find 20 minutes to be able to find some benefits.
Yeah, and then also it's benefits as far as using it post exercise. So like if you, let's say you've gone through a workout, it's getting a lot of attention now as far as then now supplementing traditional strength training with like then additional sauna use. I think the idea behind is, well, one, you got kind of already have a slightly elevated heart rate from your exercise, and then now by you know voluntarily sitting in this hot environment, it's putting more stress on the cardiovascular system. So then we also kind of see, I guess it'll help increase the signaling as far as trying to send, I guess, improvements to the desired area, the area we're targeting during our strength training. So I think one thing we see is like an increase in the, I guess, like the mTOR receptors. Is that, if I'm not mistaken?
I
Uh,
believe so. Yeah.
which is basically just kind of like our bodies knows where to basically kind of send a signal to send I guess like the repair process too.
Yeah, I think that there's definitely something to be said of the whole recovery, if you will. And if you think of zone 2 cardiovascular exercise, that typically could be considered a bit of a recovery after a super strenuous workout. So if we can tap into a similar mechanism, I think that there's definitely going to be benefit to the recovery process.
Yeah. Oh yeah. One thing I definitely didn't think about, haven't mentioned yet, is I guess timing on this. So we talked about post exercise, but also typically when we use heat therapy, we want to kind of maybe time it a little bit later in the day because we can also then uh, it'll also see improvements as far as like sleep quality because I think the idea behind it is since we're heating our core temperature up, we see this increased cardiac output and vasodilation to allow more blood flow to the surface of the skin to cooling off. So our body has kind of like this opposite effect, since we have this increase in core temperature. In order to deal with it, our body adapts to try to rapidly cool it off. So by timing it a little bit later in the evening, we can essentially bring our core temperature down, which is really kind of needed to help with sleep and get all of these other downstream effects that we've kind of mentioned in prior podcasts, as far as how, in order to increase melatonin, increase testosterone, growth hormone, we have to see a cooling off the body temperature.
Right. So we see these, we have circadian rhythms, but we also have these hormonal rhythms, but we also have temperature rhythms. And so our core temperature needs to drop to basically optimize for sleep. And so if we can use this kind of increase in temperature to create this drop in temperature, it can set us up for, this good sleep environment, if you will. And so I would say we don't want it to be like, if you know what time or approximately what time you're going to go to bed, you don't want this to be like right before you go to bed, because there's still a bit of a stress. There's still a little bit of an elevated heart rate to a certain extent. So we need this to be maybe a couple hours before you would go to bed, but it's basically preparing you for for sleep. So I would say we just don't want to be like directly, if you're going to do this 20 minutes before bed, it's probably not the best time. We would want to be a little bit earlier. But yes, if we're trying to like optimize timing, this isn't something that I would necessarily be using more in the morning. It's definitely something, later in the day.
Yeah, I think we kind of gone through pretty much everything. So things you would maybe contraindications, safety concerns. Uh, yeah, if yeah, there's a lot here. I think, like, if you're somebody who struggles with uh, hypertension, who's got type 2 diabetes, we don't want to jump into this full swing as far as going 200 degrees for a full 20 minutes. We want to use caution, small doses, and just like anything, we want to kind of progress ourselves up.
Yeah, I think if you have a very serious condition, check with your personal doctor before you jump into any of this. But at the same time, we do know that there's still benefits. So I would say, like you said, gradually introducing some of these things could still see benefits. So it's not a complete contraindication. It would be a relative contraindication. So we can use these safely if done in a controlled environment, but I wouldn't just jump right in and go max, if you will. Like there needs to be a little precaution whenever doing something new, especially with a stressor like this.
So just thinking, like, you ever, like, so a lot of people will talk about how if they're starting to kind of feel a little bit sick, they'll go use a sauna.
Yeah.
What do you think the kind of mechanism of action is kind of behind that?
Well, if you're thinking of like a virus, right? Typically, the the recommendation is to kind of let the fever do its thing for a little bit. And so if we can spike core temperature, it's like mimicking a bit of the fever to a certain extent. And so certain viruses can't handle certain temperatures. And so
I know that's where they have bacteria as well.
yeah, so I think part of it is trying to use that to kind of but then we have spikes in norepinephrine, spikes in some of these other things that the body can use to almost like temporarily boost immune function. And so while we're getting some of these elevations in core body temperature, we're also getting a bit of like an immune like spike, if you will.
Yeah, that's because there's probably something to do with like those heat shock proteins too, as far as
the cleanup.
Yeah, cellular cleanup.
Yeah. So I mean, there's probably some deep mechanisms behind it, but I think that in general, I think that would be kind of like the prefer, or that's what most people are trying to utilize.
Yeah. Sorry, a little tangent. Also, things like definitely dehydration is another big concern since we're using such high heat. We want to make sure we're well hydrated because our body is trying to sweat to kind of cool ourselves down. So if we're
Right.
dehydrated, that would be a definite cause
And
of
then,
concern.
like just depending on the type of sauna. So if it's more of that steam type sauna, you know, you're not necessarily going to like, that might be a little different than like the dry sauna.
Well, yeah, because steam saunas, since the humidity is like almost 100%, uh, there's so much moisture in there. We don't get that evaporative effect from our skin, so our body's able to cool down. So that's also why uh, traditional like steam saunas aren't nearly as hot, and
Right.
our duration isn't going to typically go as long because we're not going to be able to cool ourselves down. So shorter durations on those as well.
Yeah, the stress spike happens a little bit quicker.
And the
So
same thing with like warm baths as well, since water it is such a great conductor of of heat. Use caution as far as like temperature, and duration is also going to drop off as well.
yeah, I would say, like with some sort of hot tub, if you will, like you really don't like use caution, but yeah, it's like 10 minutes is probably a good. You probably could go a little longer, but I would say you don't really want to push the hot tub too long.
Yeah, yeah. I think
We didn't talk about asthma, but if the heat, if it creates some sort, like it might occasionally create a difficulty in breathing, so that could be something to keep in mind.
well, yeah, because you're also treating an increase in heart rate, so you are like intentionally stressing your cardiovascular system.
And obviously, pregnancy, we don't want to overheat in that situation as well. So obviously, use precaution.
And then I think this is kind of like one of those big things. It's like after a night out on the town, trying to go and hit the sauna and kind of sweat out the toxins.
Yeah, probably not the best idea.
Just because you're so dehydrated. Yeah, it's kind of, I know it's kind of one of those things that we always heard that was kind of the thing to do, but just from a logical standpoint, it just doesn't really make much sense because you're already dehydrated. The last thing you need to be doing is sweating out even more minerals and electrolytes that you've.
But I also think, alcohol is a stressor to the system, right?
Yeah,
Whether you had a good time or not, it still is stressing the liver and the whole detoxification pathways. So if your body is already working overtime to process, and then now you're creating more stress, it's just additive because the body doesn't necessarily know the difference between exercise stress, sauna stress, or liver alcohol processing stress. Like it all becomes the same.
I bet the theory behind that is probably that like maybe shorter durations, that it's just going to improve circulation, so your body's kind of able to kind of like clear things out a little bit better.
Unfortunately, we know, like, the physiology is kind of what it is. So while we can make things a little bit more efficient, while we can speed things up a little bit, the amount of time it takes to process alcohol is the amount of time it takes. So we really can't override biology as much as we might think.
Yeah, true. Last thing, safety concern. I mean, it kind of makes sense. Is if you're a guy and you're wanting
Yeah,
to have kids,
sure.
I mean, this can definitely have an effect on your ability to conceive, just because since we're men, we have external genitalia, and if those get overheated, it's going to decrease sperm count. And
Yeah, like that's the argument between, like briefs and boxers and that sort of thing. So, um,
I'm
yeah,
free and I'm loving every minute of it.
yeah. So it's one of those things that we have to consider. So it's definitely something to keep in mind.
No, but they actually make these things like these cooling jock strap type things you can actually kind of wear in the sauna. I think I saw like Paul Saladino or something like promoting one of them.
Interesting. I haven't seen that, but it makes sense um, based on what we just talked about.
Yeah, so if you're trying to get see, maybe bring in a cool towel, or just
Or just minimize your time. Like
and then something about it is it's actually short duration, so it's not going to have any long term lasting effect. So as soon as you kind of stop, you're going to be able to like regain that sperm count.
yeah, it would be a short dip. It's not necessarily going to be like this absolute. Yeah.
Yeah. Um. So yeah, kind of like I said, the whole idea of this heat and sauna is we're kind of creating this broad spectrum hormesis, this stress across the body, and kind of on that same path. Another way is now this cold water immersion.
Right. Yeah. So we're basically doing the opposite.
Yeah, let's kind of take a now like maybe a kind of deeper dive into these cold water immersions. So kind of yeah, what is it?
So cold water immersion, I mean, cold plunge, you basically the common misconception is that it needs to be like freezing cold water, right? So if we look at the research, 50 to 55 degrees, maybe even like 59, I think you could see in some studies. So it's cold, but not like freezing cold. But basically, we're immersing, the entire body into a cold bath, if you will, and it's again a stressor. As soon as you get in, it's going to almost take your breath away. So that's something to be aware of. But it's one of those things that as soon as you get in, it's activating the sympathetic nervous system, and we're automatically kind of in that fight or flight.
Yeah, it's kind of like we mentioned before. It's not like temperature's not necessarily that important. It's really more the consistency here.
Oh yeah,
And what's
yeah,
nice about even nicer about cold water immersion is it's even shorter duration. So it's not even sauna and heat therapy is I feel like a smaller commitment than I guess traditional cardiovascular exercise.
sure.
Here with cold exposure, it's actually even less. So it's like you're looking for somewhere maybe 2 to kind of 3 minutes.
Yeah, and I would say we talk about like ending your shower with 30 seconds of that, just to kind of, which is interesting. So have you ever done the cold shower?
Oh yeah.
So it's like that is so much worse than the actual cold plunge. I would much rather do like full body immersion. Because the shower, it's like you get part of it on you, and it just, you never can really adapt. Whereas in the water, you're able to, even though it's a super shock to the system, I find once you kind of get over that initial shock, it's easier than a cold shower.
I think there's some psychological factor going into that because when you're going into a cold plunge, you're kind of preparing for it mentally.
True.
You know what's happening. It's just when you kind of do that switch to cold shower, it's like you've already been relaxed. You're already nice and warm and cozy in the shower.
Yeah.
And then, yeah, you kind of like if you do that cold water shower, it's like you almost have to kind of do some preparation breath work beforehand, which is also kind of what you want to do for a cold plunge as well.
Right.
The idea here is when we enter this cold water, it is the biggest kind of non-pharmacological shock to our system we can have. It's literally kind of putting you in that fight or flight system. So when we enter that cold water, I guess what can end up happening is it's that instant cold. Our body tries to protect itself. So what do we end up seeing? We end up seeing kind of the opposite we see in the sauna. Instead of causing this vasodilation, the blood vessels opening up, we can see this vasoconstriction where these our capillary system kind of then now just really condenses and closes, and yeah, which can be a cause of concern because we see increase spike in heart rate to the point where yeah, it causes shock to the system.
Yeah, there's definitely some room for caution here, but at the same time, um, it's not terrible either. So
Well, yeah, but and the thing about with cold though, that's definitely a little bit more concern is that uh, especially when you're more going into more like submersive, like if you're more of a cold plunge versus like a cold shower, uh, we can also then have it can also cause the ability to cause like almost like temporary paralysis. So it can kind of one kind of cause that vasoconstriction, but it can instantly kind of like shut down our ability to kind of be able to breathe, and also then kind of lose kind of motor function. So use caution when kind of entering, just because there's obviously the risk of, well, obviously hypothermia, but then also then drowning too because of a loss of like motor function. So
Do it with a friend, or have someone nearby, so that there's no real extreme risk.
and yeah, and then just like I said, it doesn't have to be, you know, 34 degrees, 30 degrees, somewhere in the 30s right to start. Build up a tolerance, enter with precaution.
Yeah, and like you can even start like you don't have to jump right into a cold plunge. You can start with like dunking your face into like a bowl of ice water. You can do your hands, you can do your feet, just to start to acclimate to some of this. You could get like a big like gallon bag, and you can just like lay it on your stomach or chest to just try to acclimate a bit before you go full on, submersion into the water.
Yeah, because it's such a shock to our system. Uh, like I said, yeah, it literally kind of like takes our breath away. So having some sort of tolerance and kind of built up, I think is very important as far as using this type of temperature biohacking.
Yeah, and like right now it's starting to get, cooler. So if you go out, so timing, like first thing in the morning is actually the best time, or earlier in the day, um, contrast to the heat. But right now you can go out shorts and a t-shirt, and like right now, what is it, 50 degrees, something like that out there. So you could you could get your cold exposure just by being outdoors. Um, and then it ties into the light stuff. And so like we can kind of double up, but you don't have to have a cold plunge to get the benefits. We can get the benefits in other cold ways, if you will.
Yeah, so let's kind of maybe talk about kind of what happens. So cold water immersion, we enter the cold water. We cause this instant, almost vasoconstriction, increased heart rate. With this increased heart rate, we see some physiological. We see the like release of norepinephrine, which can, I mean, that can have huge increases, which we know from just light to moderate exercise. It's kind of one of those happy chemicals that kind of gets us, essentially gets us moving. It kind of sparks us to kind of take action. That along with dopamine.
Absolutely. And so what is it, like a 530% increase and
Mm-hmm.
like a 200 something? So, I mean, we're talking like massive spikes. So, a lot of times, if you're depressed, you're low dopamine. So like these these things can be a way to kind of like break out of that, a bit of depression, especially now, seasonal affect disorder with the winter coming on, because we're not getting strong light signals. We can utilize this cold immersion to kind of spike dopamine to kind of get us through the winter, if you will.
Yeah. Okay, so we see these big spikes, we see these vasoconstrictions. So how can we maybe kind of offset some of that to kind of get more benefit out of it? So obviously this is a stressor. It's going to help us be able to tolerate more stressful environments. So kind of like some breathing, some breath work beforehand, I think is also important, just to, for one, to help minimize, I think, the effects of that vasoconstriction,
Mm-hmm.
to cause some vasodilation, to kind of open things up, so that we don't kind of shunt blood off from important areas.
Yeah, so breath work is, I mean, it can get you can get real into the weeds on breath work, but there's something to be said that the breath is really our control mechanism. So, whenever you get into the water, you kind of feel out of control because like it's such a shock to the system. So if I can control my breath, like it gives you a sense of kind of calm to a certain extent because you're in control of the breath. And so it allows us to kind of somewhat be at peace, even though it's a shock to the system.
Well, yeah, because we get really, upon entering, and like actually at the end, we have such a heightened uh, increase in like these neurotransmitters of dopamine and norepinephrine. We actually have this kind of like increased kind of cognitive effect where we're kind of like have this almost like ability to hyper focus, which is important because whenever we're like in a fight or flight sense, we need to be able to kind of essentially slow time down to kind of be able to react and kind of get ourselves out of danger.
Absolutely, yeah. So it's interesting on how that all kind of ties together, because we talked about how this isn't something new, even though we've been, kind of convinced that the biohacking, it's a new thing, right? But this has been around for ages. So um, people have tapped into these um, stressors, if you will, since we can remember, really.
Yeah, what's interesting about cold water like immersion is that I mean, it's such a big stressor, but we actually don't see big increases in cortisol spikes. So we don't get this uh, like catabolic, actually like breaking down effect that we see from cortisol uh, when we do from other types of stress. So like usually, I think it's more like mental and cognitive stress.
Hmm.
Uh, we kind of see these higher increases levels of cortisol levels,
Right.
but not from cold water immersion though.
Yeah. So I think it comes because it's a bit of a controlled stress rather than a chaotic stressor or like a random kind of stressor. So the body sees it slightly differently, which it's a good thing, right? But the interesting thing is, so since we see these spikes in dopamine, since we see these spikes in norepinephrine, those two chemicals are, you know, more prevalent early on in the day. So if we're going to time this, really kind of earlier in the day is typically better. Um, you know, Melatonin and cortisol are kind of opposites. So naturally, our cortisol is going to be a bit higher in the morning. Um, so we can kind of tap into these other two chemicals that are also typically higher in the morning, just to kind of create this like synergistic effect of going on with the timing, if you will.
Yeah, because whenever we enter cold water, our body's going to have kind of like this. It's going to cool our core temperature down, so our body, in order to deal with that, increases our core temperatures, which is we want first thing in the morning. We want to be able to increase our core temperature and kind of mobilize us for the day.
Yeah, yeah. And so there was a study that I think we looked at whenever we were preparing. Didn't it say something about like that sense of calm didn't really happen until almost 12 hours after? So like, we think of this like vagal like stimulation and how it kind of gives us the sense of calm and it can, but the effects actually are a little bit delayed. It's not like I went to the cold plunge and then now I have this like super calm.
Yeah, so it's like we have this initial dopamine norepinephrine spike early, which is kind of give this like this hyper sense of awareness. But when we get this euphoric calming sensation is kind of later in the day. It's much more delayed.
Right. So, I mean, that goes kind of back to why the consistency is important. So it's like you wouldn't want to just randomly be doing like because otherwise, if the effects are delayed, you're really not going to get the benefit. So you need this kind of consistent exposure so that you can kind of plan out how you're going to, utilize your day because like you wouldn't want to do um, cold exposure like right after your workout like because it could blunt some of the effects. So like you want to be able to kind of time your day with like the major stressful events, if you will.
Yeah. So Yeah, kind of going back to consistency. We want to get this more spread out during the week. The more consistent we have, the more better mood regulation we're going to have, and be able to kind of like just control our stress levels. And so we want to see that kind of more spread out through the week. So I think they say you're kind of looking for somewhere around like 12 minutes. So maybe like, 4 3-minute sessions a week,
Mm-hmm.
or 3 4-minute sessions throughout the week is kind of the typical protocol for that. And like I said, it doesn't have to be as cold as most people think. Somewhere kind of around that maybe 50 degrees Fahrenheit is kind of like that 50 to 55 is kind of like that, maybe that starting point.
Yeah.
Not saying you can't go colder, just it really doesn't take that much to start. I mean, if you have the increased ability, yes, you can decrease that temperature if you like. The biggest thing is cold water is we're gonna see a lot of this like anti-inflammation that comes kind of along with this. And
Yep.
as we know, inflammation is like the root to so many long term health uh, like diseases, and
Yeah, so I think the protocol is like you're shooting for that 11 to 12 minutes kind of per week. So it winds up being 3 to 4 minutes per session. Um, you can do this on the same day as you did sauna, but you would want to kind of do opposite. So like you would do cold in the morning, sauna in the afternoon or evening. Um, you wouldn't want to do this like right after a workout
well, let's
per
get a little
se.
more specific. So yes, if you're if it depends on the type of working, I guess maybe the type of workout you're doing. So if you're doing traditional strength or hypertrophy, and as we know, we talked about in previous episodes, whenever you are trying to increase muscle strength or increase the size of the muscle, it takes a certain intensity, which causes kind of localized inflammation in that tissue. And as we kind of mentioned earlier, then sending the right signal kicks it up to the nervous system. The nervous system kicks it to the endocrine system. The endocrine system, because you have that inflammation in that tissue you're trying to create an adaptation towards, it knows where to kind of send resources to. So if you're using cold water immersion, cold plunge immediately after strength and hypertrophy training, it's going to kind of blunt that signal. So now we're going to kind of decrease the effect uh, of those strength and exercise training.
Yeah, so I guess the
Where I think where it is okay to do it after immediate exercise is going to be more cardiovascular, because what we're looking for there is really just to kind of tax the cardiovascular system, and we're looking to kind of actually see with cardiovascular training, we're looking to see how quickly the heart can recover. So doing it after like cardiovascular training, that's actually a time that would be okay to do cold plunge therapy, and actually maybe slightly advantageous. But traditional strength training, uh, you want to keep it as far away as possible, or do it on your off days.
right. So there is evidence to support that we can get mitochondrial biogenesis. So we actually can improve the number of mitochondria using the cold stressor. We can improve autophagy. So we can clean up things a little bit better. So after cardio exercise, there's definitely benefits of using cold. And so the strength thing is definitely something that needs to be considered, I guess. Is and if you did your strength session, you know after your cold plunge, or like say you did it in the morning and you did your strength session later in the day, you would be fine. It's just that immediate time right after the workout. So I guess the misconception is like we want to stress our system with exercise, and then everyone's worried about recovery, and it's like recovery is important, but we don't want to recover so much to the fact that we don't get the benefits of the stress.
And we talked about before, it really depends on what your workout intention is. Like if you're in a competition setting, obviously recovering is going to be important. You're not trying to create adaptation from a competition setting. You're looking for performance. So
Yeah.
using cold therapy is fine then, but if we're, more in the training realm and trying to see more long-term performance, this is when we don't want to like kind of blunt or decrease that inflammation, because it's just going to kind of hinder our long-term success.
Right. Yeah. It's funny. The PGA Tour now has this whole like exercise trailer, if you will, that goes around with all the events. But now they've incorporated cold plunge at pretty much every event. So a lot of the guys now are doing that after the round to kind of help improve, the recovery for the next day. Because obviously walking, steep hilly courses, you're walking upwards of 7 to 10 miles depending on the course. So it does take a lot out of you. So it's one of those things that if we can recover so that we can perform our best the next day, I think there's definitely benefits, right?
Yeah. Uh, Other benefits. So yeah, this idea like it can actually with kind of brown. I know this one of the big ones like brown fat thermogenesis. So maybe this kind of goes back a little bit into protocol. So whenever we go into cold water immersion, and for like our 3 maybe 5 minutes max of time, when we get out, we don't want to try to rapidly heat up our system. We want to kind of allow ourselves to kind of naturally warm up and almost kind of like embrace the shiver. So when we do that, we end up kind of mobilizing these energy stores like brown fat thermogenesis, and it can actually kind of help with targeting and burning certain types of fat.
Correct. Yeah. So this shock to the system, but then this gradual warm up by warming up, your body is burning, fuel, right? And so the point of that would be to use that slow warm up, because if you warmed up immediately, you would kind of blunt that response. So we want to kind of naturally like just let the body warm up through that heat production from internal, energy utilization.
Yeah, and the cause for concern. So yeah, getting out like hypothermia is actually a real risk. So essentially, just getting the cold water, so kind of toweling off, maybe even standing on a towel, just because our biggest heat sinks are going to be our feet, hands, and
Right.
face area. But then, yeah, just allowing our body to kind of just naturally shiver to, increase kind of like thermogenesis and essentially, yeah, like kind of enter into this kind of almost like a, uh, more like it's almost kind of like more like oxidative like phosphorylation, where you're kind of doing this more almost like an aerobic type of uh, activity, to where we're using kind of more oxygen for fuel. So we're kind of, and as we know, when we're in this aerobic kind of respiration, we tend to burn more fat for fuel. We kind of tap into the same kind of pathway. Since brown fat is a little bit more mobilizable, we're able to kind of tap into those stores a little bit more quickly than like deeper like subcutaneous fat.
And do you know why brown fat is brown?
Actually, I don't. I may have heard, but I can't remember.
So the reason why it's brown is due to the mitochondria.
Yes.
And so everything comes back to that, right? But anyway, so by activating the brown fat, we actually activate the mitochondria. And so interestingly enough, another little quick aside. So have you ever been in your car charging your phone and then you get the heat warning that your phone is no longer able to charge because it's overheated?
Yeah, I remember that when we were trying to film a podcast and golf in the
Yeah,
middle of July.
Exactly. But
which is why it's not out there.
If you put your phone in the freezer, it tends to work, right? Or it by cooling it down.
Up into a certain extent.
Correct. So that's kind of there's an interesting fact. So like if you look at the electron chain in the mitochondria and how we create or utilize energy, those proteins actually start to shrink or come together, which makes energy production more efficient. So part of this cooling is actually at the super nano scale, if you will, that we're able to increase or improve efficiency in mitochondria. So um, not something that's typically talked about per se, but it's definitely one of the mechanisms that we're dealing with.
Yeah, it's like I remember from my like physics, like when you cool things down, you essentially decrease the resistance or the scattering effect, so you can get like a better flow of electricity, which is why I think side tangent like these like the supercomputers, the quantum computers have to be like cooled to like a certain almost near 0 Kelvin temperature.
Yeah, why are all physics experiments done at like absolute zero, or some of these like it changes how the molecule reacts, right?
It's all about energy. Yeah.
Yeah.
Uh, yeah. Other benefits as far as
I think we should talk about immune function. I think
yeah.
that's a big one. Um, we're just talking cold shower here. We're not even talking getting into a full immersion. There's like a 29% improvement in immune function, right?
Yeah. So what? I guess why is that? Why is there? I think the study was with people who were using cold water immersions. They saw a dramatic decrease in the amount of sick days kind of people took, but it's not that they didn't feel sick. It's I think it's just they're able to tolerate those stresses better, so that they were still able to go into work.
So they might have felt something coming on, and maybe previously they would have said, "Oh, I'm going to stay home because I don't feel so great." Whereas after they've built up this, tolerance to stress, right? They were able to manage like, "Oh yeah, I don't feel great, but I can still kind of push on." So I think it's interesting how it's almost even a psychological like, "Oh yeah, yeah, I'm fine." Like it almost kind of creates this anti-fragility, whereas you know if we feel this like sickness coming on, we might want to you know stay in bed and not really do anything.
Yeah, because it's going to. I think it's just going to decrease the severity of the sickness, because it's going to increase. It's going to help increase our immune system. So we're still maybe get those sick feelings, but it's maybe not going to hit us quite as hard, because now we're able to kind of deal with uh, sickness is just another form of stress. We're able to kind of deal with these stresses a lot better.
Absolutely. So I think that like you said, it's going to reduce the severity. So instead of a being a full blown episode of the flu, you might just have a little bit of nausea, and you're able to kind of push on.
Yeah.
And we probably should also talk about the psychological benefits.
Yeah.
Uh,
So we've kind of already mentioned uh, those kind of like, we'll say immediate in a sense, as far as immediately afterwards we're seeing increases in those dopamine, norepinephrine, and then later in the day we're seeing more increased levels of serotonin, endorphins, and like brain-derived neurotropic factors as well.
mhm.
Uh, so yeah, it just really kind of helps with mood regulation. And yeah, so I think it can also be a great way to kind of help treat some of these like depression and these other psychological disorders, because the big thing is that just we have this inconsistency and a lot of variation in those uh, neurochemicals. So by going through these voluntary stressors, it really kind of helps keep a balance long term in those neurochemicals.
Yeah, I heard something the other day. It's kind of interesting. So mood follows action. So if you might not be feeling the best, but we talked about consistency. So it's like, I don't really feel like doing the cold plunge today, but eventually, like, you're going to feel better after doing it. Most people, I don't know anyone that doesn't do a workout and say, yeah, I feel better afterwards, right? So it's like these stressors, even though they're maybe inconvenient or they're not something that we always want to do, we typically feel better afterwards. So I think that um, in someone that's anxious or someone that's depressed, I think if we can get them doing some lower barrier things, it's only going to help, right?
Yeah. Yeah. uh, Safety concerns. Yeah. Cold shock is real. Can kind of cause hyperventilation as far as, yeah, and like I said, it can cause, as we mentioned before, some temporary paralysis. So never plunge alone. Kind of enter gradually, and then yeah, just start with maybe not so crazy cold temperatures to start, and just gradually kind of build from there. Uh, as far as decreasing the temperature and maybe increasing the time, but it really doesn't take much time at all. We really don't need to be extending past, or definitely don't need to be going into these double digit numbers as far as time. It's really more of those, that consistency and duration spread across the week.
We see an additive effect. So, you know, if you're consistent throughout the week, that's really the most important part. It's not necessarily, oh, I did, one session for 10 minutes, one session for, like, it was just, did, like we talked about with exercise, did you send the correct signal? All we need to do is send the signal. We don't need to keep sending the signal over and over again in the same session. But it's, can we send the signal consistently throughout the week?
Yeah, and because we're immersing ourselves in cold water, it's conduction is much more efficient than convection.
Right.
So it's gonna work a lot quicker. So we definitely, yeah, don't need to be going as long, because uh, hypothermia is real, and it's going to be much quicker when we're in an actual water rather than in like a hot sauna. Uh, so yeah, definitely take that into account. So for anybody who has uh, untreated hypertension, or has a risk of high blood pressure, in family history, definitely take that into consideration and kind of use precaution.
Yeah. And, the whole progressive overload. So if you think after you become like cold adapted, the 50 to 55 degree water might not feel cold anymore, or it might not feel super. So it's like you could start to gradually drop the water a little bit, but technically you're still getting the benefits, even though you don't get that same like excessive response that you would have gotten maybe early on.
Yeah, I think it's maybe when people who start to really kind of drop those temperatures to, like, that closer to like 32 degrees. It's people who've been doing it a little bit longer, who are kind of maybe looking more for like that psychological kind of benefit as far as overcoming like adversity.
Absolutely. Yeah. I think that that's like, I know a lot of like UFC fighters, like they'll do contrast, right? They'll do a little bit of both. But they're really, they're really training their brain to like learn how to suffer to a certain extent, right? So I think that that's part of what they're trying to do. So gradually decreasing the temperature so that they still get that same agitation, for the mental side of things. But if we're just trying to kind of, for the general health benefits, it doesn't need to be that extreme.
Yeah. Things we can kind of do to kind of help and have like kind of like a synergistic effect. So when we're in a cold water, we're causing vasoconstriction. So
Yep.
we're looking to essentially almost kind of counteract that. So we want to actually keep our ability to have vasodilation, to kind of keep that stress, to kind of keep that increase in heart rate. So things we can do to kind of allow for more, vasodilation while we're doing this. Um, I mean, like more homeopathic, like some sort of like beet juice. It's going to be full. It's going to promote. I think it's beet juice high in arginine, something, or
I believe.
citrulline. It's so any sort of supplementation like arginine, citrulline that causes our bodies to release more nitric oxide, which is it causes vasodilation,
Correct.
can have a synergistic effect.
Yeah, and so we can also use our sunlight timing because typically, sunrise is going to be dominant in that red and infrared, but then the next window that we see, and depending on where you're at, it's anywhere from an hour to an hour and a half after sunrise. That's going to be that UVA window. And we know UVA light helps to create nitric oxide, which is going to also help with that vasodilation. So if you did your cold plunge outside while you're getting that UVA light, you can kind of get your additive benefits that way as well. Um, you don't have to supplement if you don't want to.
Yeah. Kind of another thing is kind of now this maybe kind of we kind of briefly touched on it before, this kind of contrasting therapy. So going from like hot to cold, hot to cold, hot to cold. Protocols for that. I think we kind of just typically want to see just kind of less duration of each, just because if we're going from hot going to like extreme cold, we're just going to have a much bigger shock to the system.
Yeah, and there's sometimes, depending on the situation, there might be almost like a 1 to 3 minute like rest period where you're not in either, where you're just kind of, you could meditate or do something. You could do some cars or like in between where you're not going straight from the super hot to the super cold. That there's just a brief window where you kind of let your body almost equalize to a certain extent.
Yeah, but for the most part, so yeah, like maybe 3 minutes warm, 1 minute cold, and then kind of cycle back and forth. But I think the key is like the typical is you want to kind of finish cold.
Correct. Yeah, the order is typically heat then cold, but you wouldn't want to go heat cold heat. You would want to make sure that you're ending on the cold.
Yeah, and that way we kind of get that effect of our body having to kind of naturally kind of warm ourselves up.
Correct. Yeah, we want to tap into that if we can.
Uh,
And the interesting thing about like this whole contrast. So if you think about the effects of the blood vessels, right? So we're kind of getting this vasodilation, vasoconstriction, vasodilation, like we're getting this almost pumping effect, right? So we can even see, I know it's not necessarily something that's like advertised per se, but we need blood vessel movement to help with lymphatic, like so we can see some of these maybe things that aren't typically like thought of, but we can see some benefits even in other areas.
yeah, because I think the more mobile we can be, uh, the better long-term health we can have. So, like, obviously, movement is important for joint health, as we've talked about probably ad nauseum in prior podcasts. But then, kind of look at this as kind of from a more of a our like more of a mobilization of our pulmonary system, because as we talked, we want to be able to have that elasticity in our pulmonary system, because we know as the stiffer it is, uh, the more increased likelihood we have some sort of like cardiovascular disease. So doing kind of this contrast, it's almost kind of like from an exercise standpoint, kind of like maybe you've heard of like this peripheral heart training.
Mm-hmm.
So you're kind of working upper body, lower body. It causes our 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 heart to have to work harder, so we're getting that cardiovascular benefit. But that contrasting of contraction, dilation, uh, allows for more elasticity in our like our pulmonary system.
Correct. And we could equate that to like vascular workspace.
Yeah,
So it's like the workspace is important whether you're talking about joints or you're talking about blood vessels.
yeah. So yeah, it's kind of kind of reiterate things. So the idea here, these temperature kind of biohacking is we're trying to create some sort of hormesis, some sort of stress,
Hmm.
a lower level of stress, something that our body can then recover and get stronger from.
Yeah, I think that if we were like, both are beneficial, both are working the stress system in general, but they're working slightly, different systems. Where heat shock proteins, yes, we have cold shock proteins, but heat is going to be working on different mechanisms. We're not going to get that dopamine spike per se. We're not going to get that norepinephrine per se, to the same extent. So we're kind of working at both ends of the spectrum. Again, what do we talk about at end range training, right? We want to work the short end and the long end. We want to work the cold end and the hot end, if you will.
Yeah. Uh, Sauna, infrared, we're kind of looking for 4 to 7 days a week, kind of that 20-minute sweet spot. For more traditional dry saunas, you're kind of looking at somewhere 165 to 210 degrees. Infrared's definitely a little bit less than that. I think it's maybe like 100, even though
In
it's always 100, like 150.
infrared, typically, like, you can't power them enough to get them as hot. So typically it's a less temperature, but yeah, I would say you're still looking for that similar time frame as far as like duration of time in the sauna.
Yeah. Cold water immersion, we're kind of looking for same thing spread across your week, but much shorter time commitment, somewhere like that 3 to 4 minute range.
And start 30 seconds to a minute. Like, you don't have to be at 3 minutes to start.
Yeah. So yeah, if you're typically a little bit more sedentary, uh, maybe more, a little bit more on the unhealthy spectrum, yeah, start small, kind of build up a tolerance, and work your way up to these kind of protocols.
For sure. So I think, what is it? We're looking at like 11 to 12 minutes kind of total time for the week on cold.
Yes, and just yeah, remember, so like 40%, at least as far as saunas, 40% decrease in all cause mortality. So I mean, I feel like this is a very low barrier to entry. I mean, you can even use hot bath, uh, hot baths to even kind of help with this. I know some people don't quite have access, but uh, I definitely think it's a great, especially for people who've been more sedentary. It's a very lower barrier of entry. Who may, like I said, not have the tissue, muscle, joint capabilities to kind of deal with these maybe more higher impacts of cardiovascular exercises.
Right, which just goes to show how much the environment plays a role in our health. Um, because I think a lot of times we take for granted our, oh, there's not really an effect, right? But if we're seeing from a relatively short duration a significant improvement in cardiovascular health, it's like, okay, well, everyone should be tapping into that, right? Like, heart disease or heart related is like the number one, killer of all diseases, right? So if we can improve, and then like neurodegeneration is, I think, number three. So it's like, if we can tackle those two with a very simple, really low barrier, like, it would make sense that like everyone should be doing some level of it, right? Or some form of it.
Yeah, because if we can mobilize blood flow, we're essentially allowing our body to decrease the repair time for broad spectrum everything. So we're going to see these very these benefits across several different systems of our body. So yeah, using both heat and cold can be a great way for kind of improving kind of longevity, body health, but also that cognitive health. We're going to see decrease in it's like neurogenesis. Uh, yeah, I think it's really kind of, it's maybe not quite There's definitely a lot more cautionary that kind of come along with these because temperature can have such a huge effect on our bodies.
Hmm.
But I think it's a definite, legitimate kind of biohacking tool that we can kind of utilize because it's been around forever. It's just everything kind of comes full circle and it's kind of getting a lot more
Yeah, and
popularity.
I think the whole term biohacking could be negative in some instances, or it might sound like fringe to a certain, but there is stacks of evidence to support this. So it's not like this um, soft science as far as like we don't have any evidence to support. Like these are very robust studies. So I think that to dismiss the benefits is it's really there's not really much to say as far as like I think that um, we should be utilizing it to a certain extent for sure.
Yeah. Uh, Anything else?
No, I think that kind of puts a wrap on it. I think, like you said, make sure that you get medical clearance if there's a potential health concern. But other than that, I think that it can be used very safely if done in a kind of controlled and tempered environment where we're not just jumping into super cold water or not jumping into extreme heat either.
Yeah. Just slowly build, go from there.
That's right.
All right. If you enjoy this podcast, please like and subscribe and share with others. And if you have anything you'd like to add, anything else, any other benefits or concerns, please drop us a comment. We'll catch you next time.